Now, Dom, do you want to explain what PMDD is? Premenstrual Dysphoric
Disorder. Yes.
Dysphoric Disorder.
So this is where one of the great
Brooke,
things
you're not
that's been
alone.
happening over the last 10 or more years has been increasing awareness of the impact of particularly female estrogen and progesterone on our mental health and well-being and on our cognitive functioning. You know, they definitely affect, you know, ADHD as well. But PMDD is where people get a very distinct change in their mood, getting depressed and irritable in the time before their period.
It's linked to neurodiversity. If you're neurodiverse,
It's
you're more likely to have PMDD.
And there's that, you know, most of us will describe having some emotional changes prior to our periods, but this is a whole different level of functional impairment and effect. It's actually one that people can get quite intensely suicidal during that time as well. That's not something that they'd otherwise be experiencing. Nowadays, there's just so much more awareness that it exists. It's very real, and a lot more work going into trying to manage it from a hormonal perspective, because that's going to the actual looking at
what are the treatment options at the moment, do you think, for people going through PMDD?
We do use so from the psychiatrist perspective, we do use the SSRIs. So that's the selective serotonin reuptake inhibitors. They're the main things that people would be thinking of when they think antidepressants. So that's the fluoxetine, the sertraline, escitalopram.
Is desvenlafaxine SNRI maybe?
It's an SNRI. That's serotonin and noradrenaline.
Yeah.
So we can use those drugs. We can use them targeted so that we're only using them in the 2 weeks prior, so people don't have to stay on them continually.
Really?
Wow. There's a lot more interest at the moment also looking at the actual hormone, getting an endocrinologist or somebody who works with
hormone therapy,
specialist GP who works with hormone therapy. Some of the
brutal.
Oral contraceptive companies, it's really interesting to watch. They're now marketing really heavily about what effects their particular product can have on mental health.
Is there evidence supporting it? That's incredible.
Yes.